blood cells are grown in the bone marrow. As seen in the picture, the top represents the infant cells, and they grow to adulthood while still in the bone marrow, as shown in the bottom of the picture. Acute myeloid leukemia, or AML for short, starts when one white blood cell mutates and stops growing. Instead of spending its energy growing, the cell clones itself. All these new white blood cells are called blast cells. These cells continue to clone themselves exponentially until they eventually force all the normal cells out of the bone marrow, which prevents the growth of new cells. When the body does not make any more blood cells, it cannot support itself and eventually dies. The average age of AML is 67. In 2004, 5-year survivor rate for white men ages 20 to 49 was 50%. The number one option for previously healthy people to treat AML is chemotherapy. Chemotherapy is a series of drugs that targets all the blood in the bone marrow and kills it. Because there is no way to specifically target blast cells, chemotherapy kills all types of cells in the bone marrow. Chemotherapy is administered intravenously over a series of days so that it can kill the blood in all stages of growth. This results in empty bone marrow and puts the patient into neutropenia. At this state, the body is very vulnerable because of the lack of white blood cells, specifically neutrophils, the cells that seek out and fight diseases. At this point of therapy, a patient can die from a simple cold or bleed to death from a simple cut. As soon as the blood drops to unsafe levels, doctors administer blood and platelet transfusions. They also administer high doses of antifungals, antiviruses, and antibiotics. One of the cells that chemotherapy kills is brain cells. This causes patients to experience both temporary and long-term brain damage. Patients tend to call this chemo brain, like hallucinations of upside-down cows. Another set of cells that chemotherapy kills is hair cells. This causes patients' hair to fall out. This is CJ Peterson. He is 25 years old, has leukemia, and is currently going through chemotherapy. What has been the hardest part of having leukemia?
The hardest part has probably been the fact that I'm always tired and I never really feel good. I've spent so many days where I'm throwing up for 4, 5, 6, 7 hours straight and I still don't feel good. And it just always is like that. I never have a day that's really great. So, yeah.
Okay, what is something that you've learned from having leukemia?
I've learned that patience is everything.
But no, the patients are everything. How long are you in the hospital on average each month?
Well, the first month after I was diagnosed with cancer, I spent 35 straight days in the hospital going through my first round. My subsequent rounds, chemotherapy lasts about 6 days, and I've had 2 other times when I've been hospitalized for between 8 and 10 days for a simple sickness that got worse. For example, I got pneumonia, and I also ended up with partial kidney failure.